right. Let's start. Whenever you're ready.
Hello, my name is Alex John. I'm a sophomore in the.
Come forward. Come slide over. No, come forward. In front of it. There you go.
Oh.
That's a better position for it. Okay, go ahead.
I'm a sophomore in the honors science research program, and I did my presentation on major depressive disorder. So, to start off, what is major depressive disorder, or MDD for short? So, major depressive disorder is a mood disorder which causes constant feelings of sadness and a lack of enthusiasm in daily events. And the exact cause is unknown for now, but it is thought to stem from chemical imbalances within the brain. And the two I'll be talking about are serotonin and dopamine. And it affects 3 million Americans daily and is very commonly diagnosed. And there are supplements that you can take to suppress the symptoms of the disorder, but there's no cure for now. So moving on to the symptoms of MDD, there is a loss of interest in activities or people. Irregular sleeping habits are also present, such as insomnia or oversleep. Loss of appetite and irregular eating and cravings, which correlates to drastic changes in weight in short periods of time. There's also erratic feelings of sadness or anger, and constantly recurring thoughts of death and guilt, often suicide, and trouble making decisions and thinking. As for the causes of MDD, MDD can be caused by external environmental factors or external factors, such as previous traumatic experiences or stress within one's life. But it can also be caused by genetics, passed down. And although it's not proven yet, as I said before, serotonin and dopamine are two neurotransmitters that are most closely associated with MDD. And low levels of these two neurotransmitters are strongly believed to be one of the causes of MDD. Stemming off of that, serotonin and dopamine. So, serotonin is a neurotransmitter which is found within the central nervous system of the brain, and it is associated with mood and social behavior. And this neurotransmitter is made from tryptophan, one of the essential amino acids in the human body. And a lack of this amino acid correlates to a low level of serotonin. And antidepressants that are made today often target serotonin and try to help bring it out and create more of it, which has been proven to work within some patients, but it's not a concrete way of dealing with it. And next one, dopamine, is known as a pleasure chemical, and it is released in response to happiness or positive stimuli, or like achieving a goal. And both of them are found in low amounts within the brain, as well with depression, as I said before. So as for treatment for MDD, like I said before, there is no specific cure for MDD at the moment. There are supplements known as antidepressants which can be taken to suppress the symptoms. The most popular type of antidepressant on the market right now are selective serotonin receptor inhibitors, or SSRIs for short. Which is a type of antidepressant that contains chemicals that promote serotonin growth by decreasing the number of serotonin receptors within the brain. And there are other alternatives such as tetracycline antidepressants, TCAs, serotonin and norepinephrine reuptake inhibitors, and monoamine oxidase inhibitors. But these often show more side effects than the SSRIs, so they're used if the SSRIs do not prove effective within the patient. So, then Prozac is an example of a selective serotonin receptor inhibitor. As for current research done on MDD, there is epigenetic procedures that are being tested to treat the MDD and has shown positive results within mice. And there are also studies on the effect of omega-3 fatty acids on the disorder. Start off with the epigenetic procedures on mice with MDD. So, in case you don't know, epigenetics is the methylation and acetylation of specific genes in order to mask or bring out certain phenotypes. And DNA is concrete, cannot change this, but it is wrapped around proteins known as histones, and these wind and unwind. The DNA winds and unwinds as a response to outside stimuli within your daily life. And the epigenome is made up of chemical tags which induces this winding. So the one that was experimented in this research project was H3 lysine 9 methyltransferase SETDB1, which is a protein that binds to the histone H3 lysine 9 and is expressed within the neurons of the adult brain. And transgenic mice, which had the SETDB1 injected into them, and regular wild-type mice were tested to measure the effect of the protein on MDD-like symptoms. So they basically produced an overexpression of the SETDB1 within the transgenic mouse. And the conclusion that was reached was the overproduction of SETDB1 within the mouse that caused great changes within behavior and exhibited antidepressant-like phenotypes within all the tests. And the picture I have there was one of the tests that they used, which was called the sucrose preference test. So, like I said before, there are eating disorder, like irregular eating and cravings, as a symptom of MDD. So, what they had in the test, they had a cage. In the cage, they put a water tap and a sucrose percentage water tap, and normally mice would go for the sucrose mixture, but the depressed mice, or the ones that showed symptoms like MDD, tended to go for the water. But then with the overexpression of the SETDB1, they started to go towards the sucrose preference as more. And then as for the omega-3 polyunsaturated fatty acids, or PUFAs, and so somatic symptoms were found commonplace within patients with depression and similar to sickness behaviors due to inflammatory activation after interferon alpha therapy, which is a treatment for patients with hepatitis C, chronic hepatitis C viral infection. So the interferon alpha therapy was often created inflammation-induced depression within the patients, and the PFUAs were used as anti-inflammatories to treat this, and the results showed that early treatments of the symptoms with PUFAs has a higher chance of preventing MDD and somatic symptoms within patients who take cytochemotherapy, which is interferon alpha therapy, or like the picture of it.
Questions?
So you said that tryptophan was the amino acid responsible for making serotonin. So what would result in a lack of tryptophan?
It's just correlated to the lack of serotonin, but I'm sure there's other like effects of having a lack of tryptophan, but it's just for this presentation, it just causes low levels of serotonin. Okay. Oh, it's low levels of serotonin are found within the brain.
So you said that treatment for the depression is to try to bring out more serotonin, but you said that this only worked with certain kind of patients.
Yeah.
Is there any reason why it didn't work on some patients?
Say that? I didn't hear that question. Just say it louder.
That treatment for the depression is using to promote like growth of serotonin, but you said that this didn't work on certain patients. Is there any reason why?
I'm not exactly sure, but it's the treatment for it, such as the SSRIs, they don't work for everybody. There are different results for everybody. They just found that a majority of people seem to have be affected by it, but then there's still some people who don't change even after they take the treatment.
So you said you also mentioned dopamine as the cause of are there any treatments, like you mentioned several treatments, but there's none now to target dopamine?
I'm pretty sure there's one antidepressant that targets dopamine, but it's just so uncommonly used that I didn't feel it was worth it. Like, I think because the way they hand out these treatments is that they start off with the SSRIs, and then if those don't work, then they move down to the TCAs, and if those don't work, then they'll move on to SNRIs. And I'm pretty sure that dopamine ones are on the lower end of the spectrum. Yeah.
So So would like those who have those who like those who use like treatments regarding dopamine, like are they show like more like severe cases of depression?
But can you
Like you said like they go by order, right? Like
Yeah,
the
yeah.
we use treatment. So if they go down all the way to like the dopamine treatment ones, then they do those patients have like greater symptoms, like worse symptoms
Uh,
of depression?
I mean, I'm not sure, but I guess it just affects people differently. I mean, just the reasons these aren't used are just because they show more side effects, not necessarily because, like, just because they don't get affected by the SSRIs doesn't mean that they have like worse depression than other people. It's not like. So,
You said, you explained how the SSRIs work, but how exactly do the TCAs SSRIs
Oh.
It's the same.
they basically promote whatever the. wait, I'm pretty sure they just promote the growth of whatever chemical that they target, so tetracycline, or this one does norepinephrine reuptake and serotonin.
So it'd be interesting to look further into the mechanism of the SSRIs. But before I ask that question, which class is Prozac called?
Prozac is a SSRI.
Okay. It's just interesting. It'd be interesting to study that mechanism a little bit more to see how it actually works, because you're actually decreasing serotonin receptors
Yeah.
in order to increase serotonin. So it almost seems like it'd be a counterproductive treatment. Obviously, it works. We use it. So it'd definitely be interesting to look more into that mechanism, why it's effective, because it kind of seems like it would counteract what you're trying to do.
Can you go back to your study and research?
Which one?
The one with the epigenetics. So, like, other than the sucrose preference, I don't really get how they measure MDD in the mice.
So mice aren't really humans, so you can't really say
They're
a
not.
mouse is depressed. So they just look for mice that exhibit MDD-like symptoms. So they use tests such as like forced swimming tests, where they force the mouse to swim within a beaker, and they also do a hang tail test. I'm pretty sure. They just hold a mouse by its tail, and then if it tries to climb up, then it's normal. But if it just accepts like its fate and just doesn't move at all, then it's considered a depressive like symptom.
Say that one more time.
Oh, so like you can't measure MDD in a mouse. It's not like human. So
Yeah.
they just look for MDD-like symptoms within the mouse, and then that's called like known as MDD within the mouse. So like there's this one test where they hold the mouse by the tail, and if it tries to climb up, then it's considered normal. But if it doesn't do anything, like it just stands there, it's considered hopelessness, and that's a symptom of MDD.
It's actually the old Dr. Bauman thing he always talks about. That's what the mouse test, where you put the mouse in water.
Yeah,
and you try to
the
drown the
force.
mouse. If the mouse tries to swim, it's evidence of being normal. If the mouse just kind of gives up
Yeah.
and doesn't try to swim, it's evidence of MDD or whatever they're looking at there. It's evidence of neurological disorder.
What if it's just like time?
I mean, they're not gonna do just one test. They're gonna do like multiple tests to make sure.
Oh,
There's also like another one, contextualized fear, where they shock it in random intervals, and then they place it in a normal cage, and if it reacts to the if it like tenses up or it does something different, like expecting a shock, then it's normal. But if it just accepts the fact that it's gonna get shocked no matter what, then it just like stays there, lies there.
Something specifically responsible for lower dopamine levels in depressed people?
I don't think there's an exact. It's not really known. It's just seen. Yeah. So,
Can the patients show no positive results
Uh,
with medicine?
it works better on some people, and sometimes it just doesn't work at all. That's why it's not a cure.
You mentioned like omega-3 fatty acids is like being a method of treatment.
Yeah.
Like how exactly does that work? Like why is it that?
Oh, it's an anti-inflammatory. So this test was pretty.
It's an anti-what?
It's an anti-inflammatory, and this test was only only used for people with chronic hepatitis C viral infection, and because they had to receive interferon alpha therapy, and they MDD was a result of the interferon alpha therapy. It was like inflammation-induced depression.
Yeah.
So they figured that if they give them PUFAs as an anti-inflammatory, it might help treat this. And yeah.
So you stated that depression could be prompted by things like traumatic experiences or stress. Is there anything like how events like that would be linked to lower levels of serotonin and dopamine? So you said how depression is usually caused by like traumatic experiences. Is there any way that events like those are linked to why the brain would have lower levels of serotonin and dopamine?
Well, serotonin is known to be associated with mood and behavior, social behavior. So I would assume that it correlates to low levels of serotonin. And let's say if your mom dies or something, right? You're gonna be sad, and that sadness can correlate to low levels of serotonin.
Have you read anything about fatty acids as in having diets higher in fatty acids tend to lead to decreased chances of MDD? Or have you read anything like that? Can you go to the slide with the epigenetics line? Okay. So you have your wild type mice, right, which we're not doing anything to, and they have kind of normal levels of sucrose intake. Right? And then you have the treated mice with they're being treated with the H3 lysine 9 transferase set SETDBL. Correct.
The wild type were they were also diagnosed with depression. Like,
So both mice.
Both mice have depression.
Okay.
And one of them just has the set DB1.
So both mice were so both groups of mice were diagnosed with depression. The CK set DBL1, we'll just call it the methyltransferase or whatever for the set D. They were treated. They're also depressed, and they were treated with the methyltransferase. And they then started showing increased sucrose intake, which is demonstrating that they have more of a normal diet intake compared to the abnormal of the wild type. What is actually going on with the methyltransferase? What is that actually doing to that group of mice?
Oh, it's the overexpression of that protein because it's an epigenome of histone H3 less than M.
So which protein? The set DBL protein?
The set DBL protein.
Okay.
It basically acetylates the H2 lysine 9, so it's more expressed because this histone was found to be more like correlated to like behavior and like.
So my question is so we're looking at H3 lysine 9. The wild type mice, do they have a lower expression of that or a higher expression of that?
Lower expression.
A lower expression of it. So when are you sure it's not higher? Because typically methyltransferase is going to transfer methyl groups. Methyl groups don't increase expression typically. They typically decrease expression. Because when you methylate something, it's going to kind of find out. Typically, I could be wrong. It could be something different here. So are you sure that that gene's not overexpressed in the wild type group? And when we use it, we're decreasing expression in the CK group. What's that?
I'm not sure.
Okay, I'm just asking. Again, just kind of my basic knowledge of this. I don't know that particular case, but something to look into a little bit. The methyltransferase, right? It just transfers methyl. You read about that for a long time, right? So it's typically going to stop expression, not increase expression. Yeah. Just look into it a little bit. Other questions? Tino, any questions? What are you reading over there? Any questions? Okay. Sonny, you're up.